Okay, what I want to show you today is I want to show you a couple of things with regard to setting up the camera. First thing, your camera comes with a protective lens cover like this, and what I do on mine is I just put a little green dot on it, and that way I always know that's my protective lens cover. And so to remove the lens cover, you just pull it straight out. Don't twist it or turn it, just pull it straight out. It comes out easily. And then to put it back on, just push it until you hear it click and it's in all the way. Next thing I want to talk to you about is how to put a new disposable lens cover on your camera. So you have bags of these disposable lens covers, and so what I do is I reach up here in the corner and I peel it open, and then I always make sure that the large end is at the top where I've opened it, and then I just push it up with my fingers until I can reach it. Then I pull off my protective lens cover, take the camera, stick it in the new sterile lens cover, and just push it till it clicks. And I'm ready to start testing. So next thing is now we're into the patient acquisition software. So just to remember, you're going to type in the patient's name. So in this case, I'm going to put in R.M. Long, and I'm going to look at the date of the one I want to test. So I've got the right one, so I'm going to start the test. So as soon as I start the test, I'm going to pick a short version, and this is the one you're going to want to do 99% of the time because this is a short, quick test. And so it's going to ask me again, is this the correct person? Yeah, R.M. Long, my birth date. So now I'm going to start the test, and you'll notice the green lights will start strobing. So what I always do is I point it down and away from the patient or that I'm going to test so it doesn't go in their eyes, because if they look at this, it's going to give them, it'd be like they're looking at a flashlight that's flashing super bright. So now what I'm going to do, and this is what I tell patients, I'm going to form a tripod with my elbows so it's super secure. I'm just going to clasp the camera like this so I can still focus it, and then I'm going to put it in my mouth. Under my tongue, and if you look up on the screen, you can see that I have lots of vascularity. So do you see how much vascularity I have? Now it's important, I've tested myself lots of times, but it's important that you find a place that has good vascularity like you're seeing on the screen. So for example, if I put the camera at too steep of an angle, I see vessels, but they're not the capillaries that I want to record to get an accurate, high quality score. What I want to do is I want to put this right at the back of my tongue. And so you see how much blacker those vessels are? That means I've got lots of blood flow. So you can see the difference between the blood flow if you have a high blood flow versus if those were light gray, those would be just grayed. Now let me show you what happens if I push too hard on the tissue, how it distorts the images. When I push it that hard, it's hard for me to focus, and it's distorting the tissue, so I'm not getting a good video of the images that are under the tongue. So the best thing to do is just put it in your mouth, and when you're testing a patient, just find a place that has the most vascularity, and then the screen is actually separated into 4 quadrants. So if possible, you want to have an equal amount of vascularity of vessels of all sizes. Preferably, you'll see lots of small capillaries. The more small capillaries, that's a good sign. Now, I have lots of air bubbles, so you can call me Bubbles if you want, but I'm going to flush with some water. Now, if you notice the bars up at the top, the focus, you want to keep the focus within the green bars, but you also need to do it by visual and see when they go the most crispy. Some people just say, oh, if it's in the green, it's good to go. You're going to get the best results if you get it as crispy as you can get it by fine focusing. So I'll just move it around until I find a really good spot, and then I'll just hold it there until I fill all the bars. So that's what I wanted to show you real quick.